Guys, today's video we're going to be talking about corrosive ingestions. So corrosive injection is basically, it can be divided into many causative agents for this, and these causative agents can be, for example, alkaline substances, acidic substances, hot pepper sauce, or some sort of boiling water that may come into the body. And yes, it is this simple. So it's acid, alkaline, hot boiling water, or maybe some really toxic spices which may damage the ball. What's going on over here? So basically, the esophageal most common causative ingestions can be, you can kind of easily just divide them by just thinking about the letters. So B as in bleaches, we use this for cleaning of our toilets, our showers. And then C can be for cleaning materials, for cleaning agents, which is, oh, by the way, all of this so far which I mentioned is made out of sodium hydroxide. This 33% over here, honestly, I am not sure what this means, but I believe it's some sort of concentration. And the D is a drain closure. Obviously, you know that a lot of us, our drains do get closed. So for that, we can use sodium hydroxide. We can use bowel cleaners. So that can be any sort of cleaning of the toilet. It has its bowel, and like kind of clean the inner portion of that, so we can use it for that. And not only that, we can use this for hair relaxants. If we ingest any of this, it can cause toxic effects to our bodies. We can also get a detergent may also cause some sort of toxic effects to our body. Let's look at this over here. We have an interesting it causes burns in your mouth or esophagus, stomach. It causes obviously chest pain, nausea, lower blood pressure, delirium. Delirium is basically a state in which we are not properly conscious. So basically means it's confusion. You're mentally confused, emotions are disrupted, can potentially lead to death. How to disinfect water with water with unscented liquid bleach. You basically add approximately 1/8 of a 1/8 teaspoon of bleach to a gallon of water. You mix it well before drinking. And if the tap water is going to be cloudy, that means you may want to add a bit more of that. If I'm not on fourth, obviously, guys, don't do this on my saying. Kind of do your own research and follow all the guidelines. We were talking about alkali, so those were, like, as we spoke about, bathroom cleaners, our drain openers, our towel bowel cleaners, or cleaning agents. Bleaches is really really important. But here, let's flip the switch and talk a little bit about the acidic ingestions. So acidic injections can be for, again, towel bowel cleaners. So that can be sulfuric, hydrochloric acid. They can be anti-rust agents. So anti-rust agents are obviously going to be used when we are talking about the metals. Anti-rust agents can be over there for the metals. And these are going to be the really key ones for kind of breaking down the rust that's going to be in our, like, for example, over here we kind of have like a tower or like any sort of equipment where we want to use anti-rust equipment. Obviously, ingestion of that can lead to many damages. With swimming pool chloride, as you know, that is hydrofluoric. We kind of said this many times that it's always there, and also battery fluids over here, guys. Kind of more or less similar thing, just more acidic. We also have powders and liquids which may cause this. It may affect the oropharynx, the pharynx, the upper esophagus, and here with the mucosa, which leads to more injury, more damage, and it can cause increased contact time. So the liquid passes through the esophagus, and it causes increased amount of surface area and increases extent of injury. We also have other corrosive ingestions such as alkaline. What is the effect of these corrosive ingestions? Well, the effect is it causes necrosis. It causes slugging off of the acute necrosis, slugging off of the epithelium, and it may lead to esophagitis. It may lead to strictures. It may cause dysphagia, odonophagia, nausea, as we spoke about previously, chest pain. We can get edema, so we can get shock. How to kind of replace this? Well, we're gonna kind of give them stabilize the airways, make sure the airways are kind of opened. We want to make sure the loss of fluid, electrolytes, and vinegar if it's alkaline, or aluminum hydroxide if it's acidic. are ingested. So these, and steroids, they may cause perforation, so be careful when you do prescribe that to your patients. And obviously, then we have what is esophageal. So we spoke about esophageal strictures that can be caused over here. Yeah, well, these are basically kind of a complication of reflux esophagitis, ingestion of causative agents, and it can lead to problems with swallowing of the fluid. And we can use barium X-ray for this. We can use endoscopies with this, and we can kind of dilate this with a balloon or a boogie. And yeah, and we can use endoscope electric and surgical surgical incisions to kind of treat it up. So that's about it. Just make sure that we do just you want to kind of drill in your mind that it kind of we can stabilize with airways, give fluids, and if it's alkaline, give vinegar, and if it's acidic, then give aluminum hydroxide. And just make sure that you know it causes dysphagia or donophagia. It can cause respiratory lingering edema, which may lead to shock in some cases. And that's about it. Hopefully you guys found this useful. If you do find this useful, please do leave a like, subscribe, and do share. Thank you for watching. I hope to see you guys next time.